Across the state, it is Diabetes Alert Day. The state health department warning the number of Texans with diabetes is set to quadruple in the next 25 years.
Here at home, the number of people with this disease is 1 in 3. Medical students in the Valley are learning how to treat patients with more than just medicine.
Channel 5's Tim Smith learned more about the holistic approach to diabetes.
When you hear the word diabetes, sometimes it's almost like a cliche because it's like, well, it's not cancer, it's not a big deal. Well, it is a big deal because if it's not controlled, it can lead to other complications that could be, either life-altering or life-threatening.
Niepa Bakani is a third-year medical student at KRGV. Losing her father to complications from diabetes many years ago played a big role in her decision to go to medical school. At the South Texas Diabetic and Metabolic Institute in Edinburgh, she and other medical students work with Dr. Yaji and his staff using a holistic approach to diabetes prevention and treatment.
Dr. Yaji actually implements a team approach. So we are a team. We have a team of physicians, Dr. Yaji, our PAs, nurse practitioners, medical students, including myself, as well as nutritionists and exercise coaches, just to help the patient to achieve a healthier lifestyle, maybe achieve a more ideal body weight, and be able to either prevent diabetes or be able to control diabetes if they already have it.
Everybody involved that's the modern type of approach to diabetic patient. If you don't do that, if you can't get the patient enrolled in all of those things we need to a better control of diabetes, you can get almost anything.
Rafael Fonteroche is from Cuba and a family medicine resident here. He stresses to the younger students the importance of treating the whole patient while trying to control or even prevent diabetes.
This is a completely different approach. You have to prevent, which is the most important thing, or one of the most important things in medicine, in the modern medicine, preventive. Because preventive is less expensive than cure.
Some patients are quick to respond to what the doctors and students here are advocating. For others, it may take a little longer. Medical student Ann Jarvis grew up in the Valley and plans to practice here when she finishes school.
I don't think they're used to this approach. They're used to just more like the medicine approach, but a lot of them understand after they're educated. They're like, oh yeah, this does play into, it has an effect on diabetes. So I think they're grateful, and I think they just haven't had this information before, or this approach.
With dozens of medical students being trained each year right here in the Valley in the holistic or whole body approach, it's hoped our incidence of diabetes will begin to level off or even drop. Our future doctors say it's all connected.
The longest distance is from the heart to the brain, and it's just, about 12 inches? Because we know something, but until we make a decision in our heart to do something about that knowledge, then change is not going to happen.
In Edinburgh, Tim Smith, Channel 5 News.